Salams, this is the People's Dispatch studio here in New Delhi. I'm Siddhantani and you're watching Daily Debrief. On the show today, we have a definite healthcare focus. We're talking about a new public initiative in Europe challenging Big Pharma. We also discuss why 15,000 nurses are striking in the United States in the state of Minnesota. And we'll also be joined finally by Anish, who will be telling us more about antitrust litigation, this time to the tune of about 25 billion euro against tech behemoth Alphabet. First up, over the course of the ongoing COVID-19 pandemic, a leitmotif has been the stark inequalities that exist in the fields of research and development, as well as production and distribution of medical products and services. The results of these inequalities were even more stark. Public health systems collapsed under pressure. The underlying issues in the health and care sector remain vast and systemic. COVID-19 vaccine inequity is just one example and just the tip of the proverbial iceberg. On the one hand, there is a system based on profit, where Big Pharma is fighting both among itself and with the outside world on patents, prices, as well as the bottom line. And on the other hand, there are public health workers, activists, scientists, and everyday people like you and I who believe perhaps that healthcare is a universal right and only a public approach can make these products and services accessible to everyone. European scientists, health activists, and health officers are now launching an initiative to advocate for the development of public capacities to tackle exactly these issues, spearheaded by the Forum on Inequalities and Diversity based in Italy. Aina Vrachar has been looking at the forum's work and this new initiative and joined me earlier via video conference for more on the new movement. Anna, good to have you back on Daily Debrief. 3 years in, record profits for pharma companies as well as, I'm guessing, private healthcare providers around the world who've been responding to and dealing with various aspects of COVID-19. The vaccines that have been developed have come from research, as we've talked about on several occasions, funded by governments, funded by public money. And yet, millions of adults in the global south have still not been vaccinated. Several inequalities exist. Is this how we are going to ensure health of the planet in the future?
Well, in short, of course not. And it's something that activists have been warning about ever since the pandemic began. Of course, the point that you make about the vaccines is the very obvious one. And there's also something else that we need to remember, that now that the drugs for COVID-19 are entering the market, the same inequities are about to happen when access to medicines is concerned. And so we are already seeing this. If we look at, for example, what happened in Germany, which secured more doses of the COVID-19 antiviral that they actually need. These doses are now likely to expire, while other places in the world have no access to the drug, and they could use it very much. So, the whole situation has really illustrated how badly organized the system is and how wrong it is to depend on Big Pharma and their production to secure the access to the basic medicines and the vaccines that we so much need.
Governments have played their own part in sort of propagating this inequality, Anna. So why exactly are European scientists and activists now looking at governments to intervene and restrict the role of Big Pharma, particularly when it comes to subjects like intellectual property?
Well, essentially, there is this new initiative by European scientists launched a couple of weeks ago. And there, of course, so to begin with, we can say that this initiative comes from Italy. And of course, Italy was one of the places which was most hit in Europe. And they have really experienced what a pandemic out of control can mean for the people and how painful it can be. And so, of course, the scientists who are there and who have been witnessing all this strife and all the pain by the people, they're saying that, Europe has already given a lot of public money for the development of the COVID-19 products, and not only of the COVID-19 products, but they finance the research. But at the end, the profits go to the pharma companies, and what the people are left with is difficult access to the vaccines and the medicines that they need. So they're saying, Europe can take a decision, the European Union, the European Commission, they can take a decision and make access to medicines a priority. They can make sure that the funds that are given and that are invested in the research and development of drugs go to a public entity, and the public entity can make sure that these medicines are made available to everyone who needs it, and not just basing the decision on what can be more profitable for them. So that's something that's about to roll out and pick up in the next days as people sign on to the initiative. And maybe something else that we can mention while talking about this is that the initiative is actually based on a report which was presented to the European Parliament already in December last year, and it's going to be discussed again at the end of this month. The report is very interesting because it basically says that, if we look at all the different options that we have at hand in this field, it's actually reasonable to expect for Europe to take such a step and say, okay, we want a joint pharmaceutical entity that's going to deal with research and development and placement of the medicines and the medical products. It's not something that would be a new way of working for Europe, because already huge amounts of money have been allocated to initiatives such as the EU Space Program or CERN for particle research. So, it doesn't stand that Europe would not be capable of raising such amounts of money, or making sure that they're actually used to the ends that they're planned for. The European Union actually has quite a good experience of doing that. So it's up to a decision, and it's up to the European Union to make the health of people a priority and take this step into practice.
Very quickly, if we can, Anna, what is the reaction or response? How is this likely to be received among health circles?
Well, of course, even if we look at the TRIPS waiver discussion that has been ongoing for the past 2 years, there have been some sympathetic and actually even friendly voices at the European Parliament in support of the TRIPS waiver. And of course, here we're talking about the left parties, which have from the very beginning supported that the development and the distribution of COVID-19 products would be carried out in a more equitable manner. So I expect them to be supportive, and they have already been supportive of the report and of the indications that it shows. And of course, it's also interesting to see that the initiative, which was launched by the Italian scientists, has already been received very well by several known names from both in the scientific field, but also by former health officials, which were quite highly placed, which they all see the importance of taking this important turn and reorganizing the pharma sector in Europe.
Thanks very much, Anna. I think we'll wrap it up on that quite hopeful note, at least for the time being, and we'll have you back on the show very soon. Thanks for your time today.
Thanks.
So like I said earlier, we're continuing to speak about the challenges that are facing the health and care sector, and in this case, the private part of that sector in the United States. As many as 15,000 nurses in just the state of Minnesota are staging a 3-day strike, demanding better pay, better work conditions, and solution to perpetual understaffing issues that have stretched the system well beyond its limits during the COVID-19 pandemic. Nurses walked off the job on Monday, the 12th of this month, mounting picket lines, chanting slogans, and demanding private hospitals and care-providing companies consider patients before profits. My man Anish, who's a regular on the show, of course, and you'll recognize if you've been watching, has been following the strike action and joined us earlier with details. Anish, welcome back to Daily Debrief, what has to be your favorite show on all of the World Wide Web. We're talking about an unprecedented industrial action from private healthcare nurses in just one state of the US, 15,000 approximately nurses going on strike. It's a huge number that's likely to have a massive impact on how these healthcare operators function over the next couple of days. They are clearly fed up with work conditions that across the country, the US Bureau of Statistics, Labor have told us that almost 40,000 workers have quit the sector because primarily of these working conditions. Tell us what the demands are and how nurses or the association of nurses is hoping to stem this tide and sort of get the system back on track.
Yes, Siddhant, as you very rightly pointed out, the issue has been long-standing. We've seen the incapability of the health sector to retain nurses and allied health workers within the sector, and that is primarily to do with the fact that the wages have not gone up in most places, and also the fact that the risks right now are much higher. This was especially clear during the COVID-19 pandemic, when obviously the nurses had to, not just nurses, every medical professional and anybody within the healthcare sector were at the receiving end of the entire pandemic. And so your safety, your work environment is quite unsafe. It becomes quite dangerous, even fatal in many cases. We know at least in the first year of the pandemic, more than 1,000 healthcare workers had lost their lives, and that was only that was when they stopped keeping a different count for nurses in many of the states. So this is definitely an alarming situation for the healthcare sector in the United States, which is already going through a sort of crisis of its own. If you look at the wider implications it has on people, on patients, on health care that is provided to average United States citizens, it is obviously going down when you compare it to very similar first world nations, high income nations. So in this case, the demands that they're putting up, which is 27 to 30% gradual pay hike over the next 3 years of their contract, is something that the nurses have argued very repeatedly is essential to retain workers, and to not just retain workers, but also to attract workers into the sector, because staffing issues have been a big problem that has started cropping up since the pandemic broke out, because of so they were not only dealing with the pandemic and definitely the unsafe environment that they were working with. They were also dealing with the fact that they had to be overworked all the time because they had to cover shifts in many places. And this is not something that is limited to the United States. We have seen this world over. We have covered a whole host of stories where health workers across the world have been talking about being overworked, underpaid, and they had to deal with staffing shortages. And it is always on the workers who have to really face these issues, because companies really just do not put up significant efforts that would actually attract people into the industry, give them enough healthcare coverage, give them enough security, job security, wages, and so on and so forth, that would actually attract more workers to the sector. That has not been done. The investments are quite bad. And as you pointed out, the fact that this is right now being called the biggest private healthcare sector strike in US history shows that and this is only just one state, shows that how big the crisis is, how imminent the crisis is. And this is something that really needs to be taken care of.
Thanks very much, Anish, for that update. For our final story on this episode of Daily Debrief, we move from big pharma to big tech in Europe. Not for the first time, Google AdTech is under scrutiny from antitrust regulators after publishers have sued for claims amounting to as much as 25 billion euro. The French competition watchdog fined Google 220 million euro last year, and both the European Union as well as the United Kingdom are investigating whether the ad tech business gives alphabet companies such as Google an unfair advantage over publishers and advertisers by manipulating how and what we see on the internet. Anish was with us still and spoke about this developing story and what's likely to happen in the coming weeks. Anish, thanks for sticking around, not that you really had a choice. But 25 billion, Anish, which I was mentioning earlier, is what the sort of claims are that these publishers are suing for. What are the lawyers saying in terms of how they came to this amount and why sort of this or Google's ad tech is in violation of established competitive practices?
Yes, so if you look at it, the lawsuit allegations are quite simple, and it's quite similar to what we saw a couple of years ago in the with a similar set of lawsuits, a federal lawsuit in the United States. The fact is, like the basics of the manner in which adtech works is it mines user data to, what they say is to make search engines simpler and easier, and to also help their advertisements reach better targets. Now, that is what the claims are. It sounds very benign, but if you look at how they are mining this data, how they are collecting it, and how they're making use of it, that is where the more sinister part lies. They are also claiming that they cannot really put a value to the kind of data that we have collected over time, which is pretty much our personal data, our preferences, our online searches, everything, all set into one. And then that's what they are using as a revenue source, a major revenue source for them. For the publishers, it's a couple of other things that are also problematic for them. One is the fact that high commission is being charged because they control such crucial and valuable data, which also has its own anti-privacy sort of implications, but we will get to that later.
Maybe on a separate show altogether.
Exactly, and maybe somebody much better in the topic than me. But it is the fact that this data is the monopoly that they have over this data is being used as to charge higher commissions, and also to to give preference to certain kind of advertisers and advertisements. And you have certain set of very niche or very specific set of advertisements not reaching their targeted audience because Google controls who gets the ads and who sees these ads. It is the complete control over how these advertisements are put out. That is where the publishers are coming in, and that is where the antitrust lawsuits come in. It is basically the amount of control that they have over this data, and also the manner in which this data is used, and how these ads are distributed. And that pretty much would remind us a whole lot about similar kind of lawsuits that have happened since Microsoft, where antitrust lawsuits have been put up, and where big tech companies have often used their control or their specialization or patent on certain set of technologies to give preference to their own set of products. And that is where, like, we saw the very similar case of Internet Explorer. We do not really talk about it today, but it is very similar to that. It is how they are trying to put up their products to the front, because obviously they are also advertising themselves. And that shows how Google kind of controls this entire ad space right now. And that pretty much is the sum of the lawsuit. Obviously, Google is, Alphabet especially, is a multi-billion-dollar industry. It is worth more than $250 billion right now. And obviously, a $25 billion may not seem like a huge sum, but this is, and obviously we are not even sure if the commission finds Google guilty of it, they're going to charge it the entire amount. But
it's an upper limit of sorts, I guess.
Exactly. So, but it's still something that will bring attention to the fact that there are problematic practices in the tech industry that really needs to be sorted out, and that is not being taken care of, especially. And this obviously has its own, as I said, anti-privacy implication that also needs to be sorted out, that many countries are also avoiding to take care of.
And it has, of course, a massive impact on publishers and producers of content, whether it's news or all kinds of other content on the internet, no doubt. Very quickly, if you can, Anish, because in the past, competition watchdogs have fined Google for similar infringements in Europe itself. Is that likely to play any sort of role in how the courts in the UK and the Dutch courts, how they will view the investigation and proceedings?
Definitely. The fact that these litigations are happening is because of the fine that the French Commission had put on Google, the $250 $1 million that were fined on Google. And that is the basis of the litigation right now, because Google did not challenge any of the claims and allegations made in that lawsuit. It just settled the lawsuit and it opted for the fine rather than sort out a whole host of other issues that might obviously come with it. So it shows that the litigants are upbeat. They see that there is certain level of precedent that has already happened, and that is definitely going to impact how the commissions, courts, not just in UK and EU, but also in the United States and other countries may perhaps, if they start filing lawsuits like this. We have seen similar kind of lawsuit even in Australia, where publishers have talked about, news platforms especially, have talked about how Google's ad revenue arrangement is problematic, and it puts them and cuts down their revenue sources more than anything else. So in all of these cases, definitely this is something that is going to have an impact that can be globally verified, because obviously Google and the manner in which it mines data is not something that is limited to borders, obviously. So this definitely will have its own implications in the long run that will be international.
Thanks very much, Anish. We'll leave it as a surprise to our viewing audience, whether we'll see you tomorrow on the show or not. But that wraps it up for today. Thanks for all those updates. And that is also a wrap for this episode of Daily Debrief. From Anish, myself, and the entire team here at People's Dispatch, thank you very much for watching. We'll be back again, of course, same time, same place tomorrow. Until then, if you need details on any of these stories or the other work that we do, head over to our website, peoplesdispatch.org, and give us a follow on the social media platforms of your choice. Thank you for watching. Stay safe. Goodbye.